Hi there, I'm Dr. Amy Alderman. I'm so excited that you chose me to be your surgeon for your labiaplasty procedure. I wanted to do this video just to kind of help educate you in regards to your postoperative care and course. This is going to be a great procedure for you. I'm really excited, and we want to hold your hand through the whole way, which is why we did this video. I think the first thing to talk about is what to expect the night after surgery. You'll have some discomfort. It won't be that bad, but some discomfort. For the first day, night after surgery, definitely want you to go home and rest. You can do an ice pack conservatively, and the ice pack can be done for the next 2 to 3 days, but I want to talk about how you do this. I do not want you to use any freezer gel packs, freezer packs. You can use a bag of ice or a bag of frozen peas, but I definitely need a washcloth or some type of cloth over the surgical area, and then put the ice on. 20 minutes at a time only 20 minutes, and maybe ice every 4 hours. I do not want you to ice too much. You can get frostbite down there, so we want to avoid that. But the icing is good, so 20 minutes every 4 hours for the first 2 to 3 days. Secondly, it's really important that you rest. I want you at home on the couch watching your favorite Netflix show or whatever you want to do, but resting for at least 4 days. Minimize walking around, no going shopping with your girlfriends, no going to the movie because you feel good. I want you at home and resting, because the more you walk around, the more friction there is down there, and it can irritate the incision. You may have a little bit of drainage from the incision for the first day or two, so having a very light maxi pad in your underwear is helpful in case you have a little bit of drainage. Do not panic or worry if you have, let's see, a little bit of blood on the pad for the first day or two. It's a very vascular area, and you can leak a little bit of blood. That's okay. Only have it for the first day or two, and then when you don't have any drainage, don't use it. Let's talk about underwear. I do not want anything tight. So you can either go without when you're at home with some light, some very loose sweatpants, or loose boxer shorts, kind of the girly form of boxer underwear is fine. I do not want a thong or anything that's constricting down there, because it can rub on your incision. That leads us to clothing. No tight clothing. No coming in with some really skinny pair of sexy jeans or anything tight yoga pants. That's not going to help our cause. We need the area to be nothing rubbing on it. We want loose clothing, so skirts or loose sweatpants, anything that's not constricting that area will help us. You're going to be given just 1 dose of antibiotics. You'll get an antibiotic before I make incision, before the procedure. You'll have 1 dose afterwards, and we're also going to give you some diflucan. That is it's an antifungal medicine to help prevent yeast infections, because we all know that sometimes if we take a lot of antibiotics, we get a yeast infection. We don't want that down there, so that's kind of the regimen for that. In regards to how to care for the incision, we're going to give you something called hydrogel. It's a very light lubricating gel that you can put on the incision. It acts like a mechanical barrier, so that if you urinate, it gives you a little bit of a barrier. So you're going to have a little squirt bottle that you're going to use to squirt on the area to clean your incision, and then you can put some of the hydrogel on. I do that probably for the first week. Do not put anything else on your vagina, okay? So no Aquaphor, no Vaseline, no antibiotic ointment, no antifungal ointment, and do not use those cleaning wipes for that area. I've had patients have an allergic reaction to all of those, so we want to avoid that. Other kind of general instructions: I do not want you to submerge in water for about 4 to 6 weeks, so no swimming pools, hot tubs, or oceans until we make sure the incision is well healed to limit your chance of an infection. No, nothing in the vajayjay for 6 weeks, so no tampons, no intercourse, no horseback riding or bicycling, anything that's going to cause trauma to the area. Lastly, do not take a mirror and stare at your vajayjay for the first 2 or 3 weeks after surgery. The area gets really swollen. The tissue is just like the lips on our face. Somebody knocks you in the mouth and you get a fat lip, same thing down there, but what I'm doing is a bit more traumatizing to the area. The labia can become very swollen and a little bit bruised, and so the way they look for the first 2, 3, 4 weeks after surgery is not how they're going to look afterwards. So just relax, stay home, rest, and we look forward to seeing you on the day of surgery. and on your post-operative visits. And of course, we're always here for you if you have any questions. Thanks so much.